is Princey, Associate Professor in Mental Health Nursing. We've got the various treatment modalities for treating the psychiatric conditions. So, the first line of treatment for treating a psychiatric condition is the use of psychopharmacological agents. At times, these psychopharmacological agents, when we use in the clients, it may be a big failure. So we have got to opt another mode of treatment. So one such modalities of treatment is the physical therapy. It is also very commonly used for treating the psychiatric conditions. So these physical therapies are otherwise called as somatic therapy, wherein these are going to bring about a physiological effects in the clients. So one of those important physical therapy or the somatic therapy is the electroconvulsive therapy. Electroconvulsive therapy is a type of the somatic therapy which was first used by Binney and Soliti in the year 1938. It was found that the ECT used to cause many side effects and complications. So later on, there were revisions on how a ECT procedure has to be carried out, how the ECT procedure are to be improvised to reduce the side effects and the complications. So they had done so many research and they have successfully found the effective method of administering the ECT with lesser complications and side effects. So from the year 1980, ECT or the electroconvulsive therapy is used as a unique treatment for the psychiatric conditions. So let us see the definition of electroconvulsive therapy. Electroconvulsive therapy is the artificial induction of the grand mal seizure through the application of electric current to the brain. The stimulus or the electric current is placed or applied through the electrodes which are placed on the bilateral side, that is the frontotemporal region of the brain, or unilaterally on the non-dominant side of the brain. That is, if the client is a right-handed person, the non-dominant side is the right side of the brain, so the electric current will be, or the electrodes will be applied onto the right side. So this is the definition. We have got another definition. It is the treatment in which the grand mal seizure is artificially induced in the anesthetized patient by passing the electric current through the electrodes applied to the patient's head. So you can imagine, so we have got a patient who is anesthetized, and through the electrodes which are placed unilaterally or bilaterally, the electric current which a set voltage is passed, which will produce the grand mal seizure. So that is the definition of electroconvulsive therapy. Moving on to the types of the ECT. Okay, we have got, based on the technique of the ECT or the method of delivering the ECT, we have got the first one, the direct ECT, the second one, which is the modified ECT. Now, what is the difference between direct ECT and modified ECT? In the direct ECT, the psychiatrist or the anesthetist will not be using any kind of the muscle relaxant or any kind of a medication or anesthetic agent before they administer the ECT. That is a direct ECT without administering any kind of anesthetic agent or a muscle relaxant. ECT will be administered. So the second type, which is a modified ECT, so here they are going to administer the anesthetic agent and the muscle relaxant before they administer the ECT. So that is the second type, which is modified type of the ECT. So that is about based on the technique or the method of administering the ECT. The next type is according to the placement of the electrodes. Okay, according to the placement of electrodes, the types of ECT we have. One is the bilateral ECT, the second is unilateral ECT, And the third one, which is the bifrontal ECT. So, as the name says, the bilateral ECT will be placing the electrodes bilaterally on both the sides, that is from a midpoint from a line joining the tragus of the ear to the lateral canthus of the eye. The midpoint you have to take, and 1 to 1.5 inch above the midpoint, the electrodes will be placed on both the sides. So that is bilateral ECT. The unilateral ECT will be placing the electrodes on the non-dominant side of the head of the patient. So we'll be giving the electric current. The third type, which is the bifrontal ECT, as the name says, we'll be placing the electrodes on both the sides, okay, on the frontal region of the brain. So through that, the electric current will be passed, especially related to the memory impairment. Okay, so these are about the types of the ECT. Moving on to the indication of ECT. So if you take the overall indication of ECT, especially we opt or we go for a ECT procedure when the drug therapy fails, right? When the psychopharmacological agents are not effective in treating the clients, okay, there is no improvement in the symptoms, we may opt the second option of, ECT. Or when the drug therapy is causing severe side effects in the patient, okay, so even in those cases we opt for the ECT. The third condition is when the condition is very severe. Okay, so say for example, acute attacks or acute main condition, acute aggressive condition. So immediately when we give the drug therapy, it may not be effective. So in those cases, we opt for the ECT. Okay, so let us see in detail about the indications of ECT. The first indication is the depression. So in the condition of depression, we have got various types of forms of depression, the reasons why a person ends up with a depression, right? So a person who is very depressed, who is having the suicidal ideations, who is refusing to eat the food. So in those cases, we opt an option for the electroconvulsive therapy. So we have got the major or the severe depression with the suicidal risk, and also the severe depression with the psychotic features of delusions and hallucinations. We opt for the ECT. The next indication is the depressive stupor. Then we have got the puerperal depression and the postpartum psychosis. So why puerperal depression or the postpartum psychosis? So in these conditions, we cannot administer the psychopharmacological agents because the mother will be feeding the baby. So through the breast milk, the effects of the drug can pass on to the child. So it is better to prevent that. We opt the second option of going for ECT in the postnatal period if the mother is having any conditions of depression or the psychosis. The next one is depression, wherein the client is having a very poor intake of food and fluids, so refusal to food intake. Okay, so in those conditions, we opt ECT. The next condition is depression in the elderly patients. Now, why depression in the elderly patient? When we administer the antidepressant drugs, is going to have an effect on the client, right, on the elderly group of population, wherein it's going to depress the client's respiratory system, is going to weaken the system. Physiological effects or the side effects can be seen in the elderly client. So better option is the ECT. The next condition is during the first trimester of pregnancy. Again, why ECT? Because when we opt drug therapy in the ladies who are pregnant, right? So again, it can pass the placenta barrier and can cause the teratogenic effects on the fetus. To avoid that, we opt a better option of ECT. The next condition is depression with the physical illness and schizoaffective depression. So, wherein the conditions of both the schizophrenic or the psychotic symptoms with the depression to manage with the drug therapies found to be difficult, so we opt for the ECT. So that is the first condition wherein the scenarios of depression the clients may have. So in those conditions we offer ECT. The next indication is obsession and compulsion. So, in the conditions of neurotic disorders or the anxiety producing disorder, especially the obsession and compulsion, we opt for the ECT. The third indication is in the schizophrenia. Right, so we have got various forms or the types of schizophrenia. We give the antipsychotic drugs, so you know the very important side effects of the antipsychotic drugs, which is the extrapyramidal symptoms. We're going to see very severe side effects. So client may not be able to tolerate that, or he may not, be able to be effectively treated with the antipsychotics. We opt for the ECT. Let us see the conditions in the schizophrenia. The first one is a catatonic schizophrenia or catatonic stupor. We have got the acute schizophrenic episode, acute phase schizophrenic condition. Puerperal schizophrenia. So again, during the postnatal period, the postpartum psychosis or schizophrenia, we are using the ECT. During the first trimester of pregnancy, if the mother has developed the schizophrenic conditions, we may not opt for antipsychotic because it can have a teratogenic effect on the fetus. We opt for the ECT. The next one is schizophrenia with the depression, schizoaffective disorder. So that is about the indication related to schizophrenia. Moving on to the next indication, we have the mania. So right, again in the manic condition, wherein the client may not be responding to the antimanic drug or mood stabilizing drugs, okay, we'll be opting for the ECTs. The conditions like uncooperative patients or uncooperative behavior, very aggressive behavior, it cannot be controlled, and we take such clients for the ECT. Bipolar mood disorders with a rapid cycle, bipolar disorders and the mixed disorders which are going to have an effect on the behavior, mania during the first trimester of the pregnancy. So these are the conditions in the mania where we may opt for the ECT. The next indication we have is the postpartum psychosis. So as I told you earlier also, so in those cases we may not be administering the antipsychotic drugs. Okay, so in the postpartum psychosis that you will be administering the ECT. Schizoaffective disorder and also psychosis during the first trimester of the pregnancy. So these are about the indications of administering the ECT. Now there are conditions wherein when you administer the ECT, it may cause severe effects in the client. Right? Can go for severe seizure attacks, or he may have arrhythmias leading to shock and coma as well as death. So in those conditions, we say that the ECT is contraindicated. So let us see the contraindications of ECT. The first contraindication is increased intracranial pressure, including any kind of tumors of the brain, the hematomas, and the subarachnoid hemorrhages. So in these conditions, there may be an increase in intracranial pressure, which is later going to have an effect of, making the patient to end up with the coma as well as death. Okay, it's going to increase the pressure in the brain. So in those conditions, the ECT should be avoided. The next contraindication is the acute myocardial infarction. Now, why acute myocardial infarction? When the ECT is administered, there is an increased chance of increase in BP, increase in the heart rate. Okay, there may be chances of arrhythmias, can lead to the sudden cardiac failure or the myocardial infarction. So in those cases, we are not administering the ECT. The people who are having any kind of a cardiac disorders or acute myocardial infarction can lead to the death. We have got the cardiac conditions like any kind of the cardiac disorders, aneurysms, thrombophlebitis, bleeding disorders, or any kind of the conditions where there is risk of embolism. So in all these conditions, the ECT is contraindicated. So we have got the other contraindications like the CVA, cerebrovascular accident. Again, there may be chances of increased, ICP can lead to the complication, shock and death, right? The next we have severe pulmonary disease such as pneumonia or TB, right? So in these conditions, when we already the client's respiratory system is depressed, so when we give the ECT, we may also administer the anesthetic agents, okay, which can pull up the secretions, which can lead to more complications to the respiratory system. So in those conditions, it is contraindicated. Other conditions like fracture, dehydration, fever, glaucoma, retinal detachment, congestive cardiac failure, and the condition wherein anesthesia itself is contraindicated. So, in all these conditions, we may not be administering the ECT. Now, glaucoma and retinal detachment again. So, in these conditions, there will be an increased intraocular pressure. So, when the artificial electric current is passed, so again, it's going to have an increased pressure in the eye, can lead to detachment of the retina nerves in the eye, can lead to blindness. So in these conditions, we may not administer the ECT. Yes, so this is about the contraindications of ECT. Let us see the side effects of ECT. We've got various side effects because of the electroconvulsive therapy. The first one is death during the ECT due to the effect of the general anesthesia. So if you are not done a proper assessment, if you have not found out, the client would have had a cardiac problem or would have had, increased intracranial pressure or tumors, any other conditions. I have not done the assessment to go and administer the electroconvulsive therapy, okay, or if the client had a respiratory related conditions, pneumonia, give a general anesthesia, cooling of secretion happens, and sudden there is a death, okay, which can result. That is one of the major side effects of ECT. The second one is the headache and the body ache. So obviously, when the electric current is given, the most common side effects which is noted is the headache as well as the body ache. The another common side effect is the memory disturbance. There may be chances of loss of memory for a period of time, especially the retrograde amnesia can happen after administering the ECT. The next side effect is the confusion which can happen during the post-ictal period. So after the seizure has passed on, okay, during the post-ictal period, there may be a lot of confusion in the clients, okay, as to they would have even confused where they are, what's happening to them, why are they there in that particular place. So such severe kind of confusion can happen in the clients. The next side effect is vomiting due to increase intracranial pressure, right? As I told you, there will be a memory loss which can last for a day to a month, okay, due to the hypoxia to the brain. Because of the condition of anesthesia, there may be a chance of memory loss. Another important side effect is the fracture, especially the thoracic spine as well as the long bones fracture can happen because due to the effect of the seizure, okay, if the client is not protected well during the seizure activity, can end up with the fracture. Dislocation of shoulder joint and wrist. The other side effects are arrhythmias, aspiration, pneumonia, status epilepticus, and muscle pain as well as nausea. So these are all the side effects of the ECT. Moving on to the method or technique of ECT. So as I told you, we have mainly got the two methods. So one is the direct method of administering the ECT. The second one, we have the modified method. So when the patient is planned for an indirect method of the ECT, or it's a modified method of ECT, we'll be administering certain drugs. The first drug that we'll be administering is the atropine sulfate, usually 0.6 mg to usually 0.6 mg to 1 mg of the atropine sulfate, which will be administered subcutaneous route half an hour before we start the ECT procedure, or we'll be administering in the IV route immediately before starting the ECT. Right, so these are the drugs which are administered to reduce the secretions, okay, which can happen due to the anesthesia. Once the drug is administered, we'll be passing the electric current to the client, and artificially there will be an induction of the grand mal seizure. So because of the atropine sulfate, what we had administered, there will be chances of prolonged period of disorientation. This atropine sulfate, as I told you, it reduces the secretion. It also has got the effect to reduce the sensation of vomiting. Okay, so that can be prevented when we administer the atropine sulfate. So immediately after the ECT is administered, we see to it that the client is placed in a sideline position, see to that all the emergency equipments are there. In case if required for doing the suctioning, or if there is any other complications, we can make ready all the emergency equipments near to the client. Apart from these things, we'll be administering the anesthetic agent as well as the muscle relaxant to the client, especially in the modified type of the ECT with the oxygenation. So when we administer the general anesthesia, there may be a chances of the respiratory depression, or there may be a chances of pooling of secretions can lead to respiratory problems. So we will be seeing to it that the patient gets the adequate ventilation. So oxygenation is provided to the client. So since the patient will be on anesthesia, there may be the lot of anxiety in the patient as well as in the relatives. So always educate them the use of anesthesia during the procedure and to reduce their anxiety so that the maximum effect can be achieved. So the drugs which are used in the modified ECT, so as an anesthetic agent, we use the thiopentone sodium 3 mg to 5 mg, which will be administered. Apart from that, we have got a depolarizing agent or a muscle relaxant, that is the succinylcholine, 0.3 ml to 0.5 ml, which will be administered intravenously. So these are the drugs which are used in the modified ECT. So moving on to the mechanism of action or the mode of action. So the exact mechanism of action is not known, but we have got some theories or some proposed ideas from the various psychiatrists that this is what is going to happen when we administer the ECT. The therapeutic effect which is brought about by the ECT after we administer is mainly due to the neurochemical changes which happens, the neurophysiological changes and the neuroendocrine changes which will happen after the ECT administration. So if you take the neurochemical changes, so where they had done the investigations and they found that there is a considerable change in the catecholamines in the neurotransmitter levels because of the effect of the ECT. And even because of the effect of the seizure, they were seeing that the biochemical changes were brought about in the catecholamines. So that is the neurochemical effect. So moving on to neurophysiological effect. Now why the neurophysiological effect happens? It is because of, when you administer the ECT, the client will have a hypometabolic state in the brain or in the cerebrum. So because of that, there may be chances of decreasing the severity of these symptoms because of the hypometabolic state of the cerebrum. Moving on to the neuroendocrine changes. So the neuroendocrine changes which mainly happens to the hypothalamus, where the thalamocortical pathways are affected after the ECT administration. So that is the neuroendocrine effect of the ECT. So this is the mechanism of action which mainly happens in terms of the neurochemical changes, the catecholamine, the neuroendocrine changes which happens in the hypothalamus axis or the pathway, and as well as the neurophysiological effect because of the hypometabolic state. So moving on to the number and frequency of ECT. So there is no fixed, number of ECTs that we can administer to the client. It differs, based on the condition of the client, the number of ECT or the frequency of ECT can be seen or administered. So if you take the psychiatric conditions like bipolar disorders or schizophrenic conditions, catatonic conditions, manic disorders, or schizoaffective disorders, in all these conditions, it is found that about 5 to 10 times of ECT cycles are more than enough to see the effect of the ECT in the clients. So that is the peak range of ECT, which is very useful in these conditions. So if you take the chronically ill schizophrenic patients or the client, they may require the more cycles of ECT. Say, for example, 20 to 25, maximum 25, cycles of ECT treatment that a chronically ill psychiatric condition may require. Okay, so that is not a fixed one. So it depends on the condition or the severity of the condition, the frequency or the duration of the ECT depends on. If you take the ECT treatment, most commonly ECT is administered 3 times in a week. So in the patients who are very much severely agitated or they have severe suicidal ideations, it is preferred that they receive the ECT therapy, initially every day. Okay, till the symptoms are reduced. Later on, they may taper it down to alternate days or say 3 times in a week. So, depending on the condition, so if the acute conditions or severe conditions are there, initially we give the ECT treatment on a daily basis. Administering ECT doesn't mean that it will prevent the relapse. No. Yes, so along with the ECT, as a maintenance therapy, we have to, even administer the psychopharmacological agents, or the patient may have to undergo the psychotherapy for the successful completion of the treatment. So, the treatment modality, if you take in psychiatry, it is not the one form of treatment or one mode of treatment we give. We give a combination of the therapy, either psychopharmacology coupled with the ECT or psychopharmacology with the psychotherapy. So, like that. So, ECT doesn't mean that there is a complete treatment for the patient, no chances of relapse. No. So, we will be having a maintenance therapy with the psychopharmacological agents and the psychotherapy. Moving on to the complications of ECTs, okay, we have got a list of complications which can happen when we administer the ECT. The most common complication is the memory deficit or the loss of memory, which can go to an extent of forgetting the names of the other people or forgetting even the place where they are, to even severe confusion. That is the major complication of the ECT. To start with, initially the patient may have a loss of memory of forgetting all the events, but later on it is only limited to the events which just happened before the ECT. So because of this, there may be lot of anxiousness in the client as well as the relatives. You, as a nurse, you should be in a position to educate them, to reassure them these changes are only going to be temporary. Need not have a lot of anxiety for this, right? So that education that you will be giving to the client as well as the family. The memory will return fully from a few weeks to months. However, even though there is a memory problem or the loss of memory, the learning capacity or the learning ability of the client is retained. Okay, so that is about the memory loss, the first complication. The second complication, which is again most common, is fractures and dislocation. If the professionals are not provided the proper safety for the client during the ECT procedure, during the seizure activity, okay, they are not cared for, then the client may accidentally have these fractures or the dislocations. So most commonly it is because of the muscular contractures which will happen during the ECT, compression fracture of vertebrae, that is the dorsal vertebrae, between the second and the eighth usually, or the fourth and fifth is usually seen. Okay, so these are the vertebrae which are more prone for dislocation or the fracture. In the younger clients, okay, there may be chances of fracture of the long bones, especially the femur and the humerus. There may be a complete rupture between the head and the shaft of the bones of the femur because of the restraints which is applied during the ECT procedure. In the elderly client, you can see that there may be an impacted fracture. There may be dislocation of the jaw, especially during the tonic phase of the grand mal seizure. Always during the tonic phase of the seizure, see to it that the jaw is protected by applying the pressure onto the chin upward. Okay, so this is going to prevent the complication of jaw dislocation. So that is the complication which happens in terms of fracture and dislocation. Moving on to the next complication, which is the respiratory depression. So if you take the respiratory system, there may be chances of apnea because of the effect of any condition wherein the client undergoes general anesthesia, right? If he's having a problem with the respiratory system, there may be a chances of apnea. So to prevent this, you see to it that during the ECG that you have a proper airway intact. Prevent the collection of saliva by doing the proper suctioning, which can result, if the saliva is pulled up, can result in aspiration or pneumonia. So to prevent that, you have to see to it that the proper suctioning is done. Once the ECT procedure is completed, see to it that you provide a proper position, side lying position to the client. See to it if there is excess salivation or secretions coming out. Suction the client frequently and give the oxygenation or administer the oxygen for short duration of the time. So all these are going to prevent the respiratory problems. If the apnea is prolonged, then it is necessary that you provide artificial ventilation to the client. So always keep all these emergency equipments near to the client, because anytime the client may go for the complications, so that if it is there ready, you can immediately start the artificial ventilation. Okay, so these are the major complications which can happen due to ECT. Apart from that, the clients may have many other complaints. Okay, so it can be headache, backache, injury to the mouth, and as well as the tongue, which happens during the seizure activity. There may be chances of fear due to the unpleasant experience that the patient had underwent after the treatment. So always reassure the client, reduce the anxiety or fear of the client. So all these complications are to be prevented. You should be very much vigilant, okay, in doing the assessment and observing the patient during the postnatal period, so that these complications can be prevented. Okay, so this is about the complications of it. Moving on to the placement of electrodes. So as I told you, the placement of electrodes, mainly we follow the two placement. One is the bilateral placement of the electrode. Second is the unilateral placement of the electrode. So if you take the bilateral placement of the electrode, where exactly is the position to place the electrodes? You can see here in the image. Each electrode is placed 2.5 to 4 centimeter above the midline from a point joining the tragus of the ear to the lateral canthus of the eye. So 2.5 to 4 centimeter above the midpoint of this line. Okay, so we'll be placing the electrodes bilateral. That is the most common placement of electrode which is done. The next is the unilateral placement of electrodes. So in the unilateral placement of electrodes, we'll be placing the electrodes only on the one side, especially on the non-dominant side of the client. So if I am the right-handed person, my dominant hand is the right hand, but my non-dominant side of the brain is the right side of the brain. So it will be placed onto the right side. So only in one side the electrode will be placed. So that is the unilateral placement of the electrode. Moving on to the voltage of electric current, very, very important. Okay, so voltage, how much volt of electric current is to be passed during the ECT procedure? According to the American Psychiatric Association, the standard voltage, which is very commonly used, is 70 to 120 volts, and the duration of passing the electric current is 0.7 to 1.5 seconds. Okay, so this is the universal dose of the or voltage of the electric current and the duration of the electric current that is to be passed in the ECG. Moving on to the types of seizure produced. So when you administer the electroconvulsive therapy, the type of the seizure which is produced is the grand mal seizure. So if you take the grand mal seizure, you've got a clonic phase and a tonic phase. The tonic phase, which is usually going to last for 10 to 15 seconds, and the clonic phase is going to be a little longer than the tonic phase, which will be lasting for 30 to 60 seconds, right? So this is the duration of seizure which will happen in terms of tonic phase as well as clonic phase. Moving on to the ECT team. So when you administer the ECT, or before you administer, you plan for a ECT procedure, see to where the team is ready. So who are the members in the ECT team? So we have got the personals like the psychiatrist, we have got the anesthetist, we have got the psychiatric nurse, we've got the nursing aides, and the ECT assistants or the technicians. So all these are the members or the ECT team. Moving on to the treatment facilities. So if you want to conduct or you want to administer the ECT, you should see to it that the facility is available in the psychiatric hospital. So if you take a standard hospital, the ECT procedure happens, which will be having a suite of 3 rooms, right? So one room is for the pre-ECT room. Okay, before you actually give the ECT, the patient will be resting there in the pre-ECT room. Okay, then we have got a ECT room wherein actually the procedure of ECT happens, and you've got a third room which is the post-ECT room or the recovery room. Right after the ECT, the poor patient will be shifted there for the observation. So if you take the pre-ECT room, see to it that the pre-ECT room is comfortable, it is calm, free from all the noise. It seems to be pleasant. Okay, that is the setting in the ECT room. If you take the ECT room, it has to be equipped with the equipments which is necessary for the ECT procedure. So we have got the ECT machine and its accessories. We have got the anesthetic appliances, the suction apparatus, face mask, oxygen cylinder with adjustable flow valves, curved tongue depressors, mouth gags, resuscitation equipments, and as well as the emergency drug. Along with this, also see to it that immediately if you require any kind of immediate action to be taken in terms of complications, the defibrillator also should be at the ECT room. So these are the equipments which are supposed to be there in the ECT room. The next room which is there is the post-ECT room, otherwise the recovery room. Mainly we'll be doing all the vital signs, okay, all the equipments related to the vital signs, providing position to the client, okay, so orienting the client, reducing the confusion. So all those things will be done in the recovery room. So let us see the articles which are required for the ECT procedure. So we require an anesthetic medication, okay, or anesthetic drug. We require the suction apparatus, the face mask, oxygen cylinder, tongue depressor, mouth gag, resuscitation equipment, full set of emergency drugs, defibrillator, and the drugs which is required for the ECT procedure, and a well-equipped recovery room. Okay, so these are the equipments which are required for the ECT. Moving on to the role of nurse. Okay, so the role of nurse is in terms of the pre-ECT care, during the ECT, and the post-ECT care. So let us see the role of nurse in the pre-ECT or the pre-treatment evaluation. So what is the responsibility of the nurse? So before we start the ECT, you see to it that you collect or a detailed medical history, the psychiatric history, history related to allergies to any kind of the drug, anesthetic agent, all these history that you have to collect. The second thing that you will be doing is assessment of patients as well as the family's knowledge related to the ECT. So educate them, find out whether they have got the complete knowledge about the indications, contraindications, side effects, complications. So what is the procedure which is done, how it is done. Everything has to be informed to the client as well as the family, and see to it that they have got the education related to it. And informed consent, which is very much mandatory to reduce anxiety and fear about the procedures by explaining everything about the ECT. Assess the baseline vital signs of the patient, okay, the respiration, the blood pressure, the heart rate, temperature, basic things that you have to monitor the vital signs, because if there are any changes, if say for example the heart rate is increased or BP is already increased, and those candidates may not be taken for the ECT until all those parameters are come to the normal to avoid the complications. Ensure the patient is on empty stomach, okay, about 4 to 6 hours of fasting. prior to the ECT should have been ensured. Withhold the night doses of these drugs which is going to increase the seizure threshold, especially these diazepam, barbiturates, and anticonvulsant drugs. Withhold all the oral medications in the morning. Ensure the patient has shampooed the head, because if there is a oily content in the air, it is going to impede the electric current. Okay, so see to it that the patient has done the head shampooing. Ensure that all these jewelries, artificial, dangers, prosthetics, all these metals, anything which is there onto the patient should be removed, and the tight clothing should be removed before the ECG. See to it the patient empties the bowel and bladder before the ECG. Make sure that the administration of the drug is done, that is atropine sulfate 0.6 mg 30 minutes, which can be given IM before the ECG, or it can be given IV immediately before we start the ECG procedure. So that is the nurse's responsibility before starting the ECT. Moving to the nurse's responsibility during the ECT, that is the intra-procedure care. What is the responsibility of the nurse? Make sure that you place the patient comfortably on the bed in a supine position. Stay with the patient to allay the anxiety and fear, reduce the anxiety and fear, give the reassurance and education to the client. Assist the anesthetist in the administration of the anesthetic medication, that is the thiopentone sodium, and also the muscle relaxant, which is the succinylcholine. Since we administered the muscle relaxant, is going to even relax the respiratory muscles. So in those cases, you see to it that you provide the artificial ventilation, administer the oxygenation to the client. See to it that the mouth gag is placed to prevent the accidental tongue bite. The place of electrode placement should be cleaned with normal saline, or and also the conducting jelly should be applied onto the electrodes. So you're going to monitor the duration, the voltage, as well as the intensity of the electric stimulus which is applied. So during the seizure activity, see to it that you monitor seizure activity via the cuff method. Okay, will be tying the baby cuff onto the extremity of the client. We'll be noticing for the dorsum of the the toes, or the flexion of the toes extension. So you're going to monitor for the seizure activity by the cuff method. See to it that you provide 100% of oxygen supply to the client during the procedure. Also, it is an important role of a nurse to monitor the vital signs, the oxygen saturation, the ECG, as well as the EG of the client during the ECT. And lastly, you're going to record the findings and record whatever the medications is administered, the response of the client. So all these things, that is a responsibility which happens during the ECT procedure. Moving on to the role of nurse in the post ECT procedure. Okay, after the ECT, okay, in the post recovery room, what is the responsibility of a nurse? You monitor the vital signs or the vital parameters of the client, especially related to oxygen saturation, the blood pressure, the heart rate, respiration. You're going to monitor that. You see to it the oxygenation is continued till the patient, has got a spontaneous respiration bank. Assist for the post-ictal confusion and restlessness. Since most of the client will be in a state of confusion, they don't even know where they are, what has happened. So always reassure the client and observe the client has become very much restless. Okay, so if the client is very much restless, you can inform the particular psychiatrist wherein they'll be administering the diazepam again to just calm down the client. Take the safety precautions to protect the client from the injury. Can be providing the side rails when you're placing the client in a sideline position, or you see to it that there is no excess secretion or salivation. Do the suctioning, okay, if it is there, because of the risk of aspiration and pneumonia. After the client recovers, see to it that you reorient the client to the particular setting and stay with the client till he completely recovers. Okay, and also see to it that the patient is completely oriented. And another important responsibility is to document, right? You're going to document the relevant findings of the patient during the post-ictal period. Okay, so this is the responsibility of the nurse in the post-ictal period or after the ECT. So very important procedure, the ECT. Mainly it is given to the client as one of the major treatment options in the psychiatric conditions, and you have seen what is the responsibility of nurse, okay, when she is a team member in the ECT team. Okay, it becomes very important from our point of view to provide all the necessary care to the client to allay the anxiety and fear, and also help the client to recover soon. Hope you all have understood the topic. Thank you.